MedPlus లో అదే మెడిసిన్ అదే క్వాలిటీ, మార్కెటింగ్, డిస్ట్రిబ్యూషన్, ఇంకోటి అంటూ వీళ్ళకి అదనపు ఛార్జీలు ఉండవు. అందువల్లే 50 to 80% డిస్కౌంట్ లో మనకు అందిస్తున్నారు.
భారతీయులు సాధారణంగా అభిప్రాయం ఏంటంటే అమెరికాలో అత్యున్నత వైద్య విధానాలు ఉంటాయి, ప్రమాణాలు ఎక్కువగా ఉంటాయి అని చెప్పేసి అంటారు. సో లాస్ట్ 5 years లో ఈ డయాబెటీస్ రంగంలో చికిత్స విధానాలలో ఎలాంటి మార్పులు వచ్చాయి? రైట్ నౌ వాట్ ఈస్ ద బెస్ట్ అండ్ ఎఫెక్టివ్ అండ్ మోస్ట్ అడ్వాన్స్డ్ therapies or treatments for the sugar right now available in US, and the same amount or same quality medicine అనేది లేదా ఇక్కడ చికిత్స విధానాలు అనేది భారత్ లో అవైలబుల్ ఉందా? What are the changes you have seen from the last 5 years in US and India?
So last 5 years we've had some nice advances with medications. So main advances are 2 medicines in the last 5 to I would say maybe even 8 years. Very popular one is glucagon like peptide 1, GLP-1 receptor agonist and unnai. So these are popularly known as Ozempic or Mounjaro. So even matram they have I would say have revolutionized how we manage type 2 diabetes. Endukante not only they have helped control blood sugars, they have helped control weight loss, but big benefit endante itlki they have heart protection to reduce heart attack risks, kidney protections to reduce dialysis risks. So that's one big, I would say, a major improvement, almost momentum paradigm shift. How we manage diabetes are less shift in where people are seeing very, very good results. The second class of medicines, it's called SGLT2 receptor inhibitors. So, very beneficial for heart and kidney tablets. But avanni are available here in India as well. So Jardiance, Farxiga, Ozempic just got, I think they got released the injections. Mounjaro got approved a few months ago. So all the medicines, konchu late vachinai gaani, they're all available here. But the main, I would say, that have revolutionized managing diabetes is GLP-1 and SGLT2 medicines. But I would say top is mana GLP-1 medications.
Okay.
So well studied, work very well. Kani okkata problem endante is the same thing that I talked before. Ivi expensive. People who are at the lower income group are the people who are at the higher risk of diabetes, people who have the highest amount of diabetes. Ivanni chala effective medicines. Kani if it doesn't reach people who need it the most, we're not going to do much in terms of lowering our diabetes risks, our mortality risks. So that is the little mana paradox and caveat. But advances have,
Okay.
these are the big advances for type 2 diabetes.